Hello, my name is Bruno Gobato. I'm speaking with Dr. Marcelo Queiroz. We are both from Brazil, and we are going to speak about, can mixed reality help us become better surgeons? Well, first of all, we need to do some definitions. The first definition is the VR, or the virtual reality. The virtual reality is a computer-generated simulation, a 3D computer-generated simulation that is very immersive. In this case, you are used principally for training. We have also the augmented reality, the AR, and we can overlap 3D images into the real world. You see in this video one of our cases is a hip fracture, a acetabulum fracture, that we can overlap over a piece of paper using our own smartphone, as well 3D printed model. But the new definition we are using today is the mixed reality, is when we merge VR with AR, and when physical and digital virtual objects, they can interact each other and they can coexist. And for that we need some special glasses. One of them is the Microsoft HoloLens that we are using for some surgeries. The principal uses for this technology can be the training. The VR is very used for training, for residents, for medical students. We can do a virtual telemedicine shared decisions, and the most important part is to fuse the virtual and the real world to perform better surgeries, to become better surgeons. Here we can see an example of a hip, affected hip. We can look at the anatomy in every place. This is an example of a mixed reality hip in an OR room. We are using a special device, a glass, a Microsoft HoloLens, and we place this hip over the patient's room, and we can, looking around, getting far and close to the object, we can look for all the directions to look for the patient's anatomy. There are other solutions. In this case, it's a solution from Clinical Graphics. It's a company that was bought from Zimmer and Biomet. They can analyze movement, they can analyze biomechanics and show impingements and show how to correct this kind of surgeries, doing preservative surgery. This is an example with what we do ourselves. This is a software, a free software called Mesh Mixer. We can do most the same. We can analyze movement, we can analyze abduction, flexion, extension, and look ourselves for potential problems, and that we can overlap also during surgery. We can do virtual image during surgery. Here we have the view of our OR. I'm using the glass, and we can place as many windows as we want. And the main advantage of that, we can manipulate this image. So we can place one window of the exam, one window of the patient's plan. We can place the virtual model, and we can place a Skype conversation with another surgeon that he can see what we are looking. So this is the new thing about mixed reality. Here's a video of the OR, the complete OR, where we can see the 3D virtual model. As you can see, we can come close, go far away. The model stays steady where we decide. We can move it around, scale or not scale, and we can perform any surgery, open, minimally invasive, or arthroscopic surgery. We can place the image, as you can see, the exams of the patient, and we can principally manipulate these exams for performing a better surgery. How can we do it? It's not that difficult. We just need some simple steps. We have to do the model, we have to have an exam. A CT scan is better, or MRI. We then can transform this exam in a 3D model using free softwares like Horus, Osiris, or 3D Viewer. And we should manipulate sometimes these softwares using other softwares like Mesh Mixer. The devices for mixed reality, we need glasses, special glasses. We are using the Microsoft HoloLens. A glass from a company called Magic Leap was just released, and it seems to be very nice. And we are expecting some other companies to release their glasses, maybe Apple, in a near future. At home, we just need a computer to manipulate and plan our surgery. So, thank you very much. My name is Bruno Gobato. If any doubts, just email me. Bye bye.